Hello everyone, welcome back to the channel. My name is Dr. Rosa, you can call me Dr. Rose, and today we're going to be talking about what's dementia, what's delirium, and what's the difference between them. So let's get right to it. So something we often encounter and manage as physicians, both in our office as well as in the hospital, are patients with dementia and/or delirium. And as a doctor, I've often noted that people who are not within the medical field find these terms often somewhat confusing. So today I'm here to shed some light and help you understand these terms a little bit more. So what's dementia? Well, dementia is defined as a decline in a person's cognitive function and behavioral abilities to the point that it interferes with that person's daily life and activities. Side note. So what's this about a cognitive function that you speak of? Well, it's technically a person's ability to think, remember, and reason appropriately. That's what we refer to. So who does dementia affect most often? Well, in general, the people who are most at risk or is seen most often is people who are about 65 years of age or older. However, I want to note that although dementia is often seen in the elderly, dementia is not a part of normal aging. So in general, what happens is that as part of aging, we lose neurons, yes. However, patients with dementia tend to lose them a bit faster than what the normal aging population does. So what are kind of the signs and the symptoms that us as physicians kind of look for to evaluate for dementia? So the first thing we look for is that a patient must have a kind of a deterioration in their memory. Plus, they must have one or more of the following things: amnesia, which can be seen as partial or total memory loss; aphasia, which is difficulty with language and difficulty speaking; apraxia, which essentially is difficulty with their motor function, such as, for example, grabbing a spoon or grabbing a pencil or a pen; agnosia, which is the inability of being able to recognize previously known places, objects, faces. Some other things we look for are problems with organization and planning, even though the person is lucid, as well as any sort of personality, mood, or behavior changes that the person might have. So what us as physicians and you as a caregiver or caretaker of someone with dementia can do about it. So what we do as physicians will very much depend on what type of dementia it is. And although there are many types of dementias, for example, the most common one is Alzheimer's disease. And although in some cases, if appropriate, some medications can be given to kind of slow down the process, unfortunately, none of these are able to cure, reverse, or stop the progression of dementia. But as a caretaker of someone who may have dementia, the best thing you can do is love them, support them, and encourage them. This is because, unlike delirium, dementia is very much irreversible and progressive. Which brings me to delirium. Unlike dementia, which is somewhat slow in its progression, delirium is defined as a sudden and serious disturbance in the patient's mental ability, resulting in confusion, incoherent thinking, and a reduced awareness of the person's environment. Delirium can develop quickly in a matter of about hours to days. So similar to dementia, delirium commonly also affects the elderly. But unlike dementia, delirium can also affect commonly children, hospitalized patients, or patients who had recently had a surgery within the past few hours. So what are the signs and symptoms that we also look for in delirium? So first off is that the patient starts to kind of go in and out of consciousness and in and out of being oriented or not, in which in between these episodes, the patient kind of comes back to normal, knows where he is, and thinks appropriately. They also tend to have hallucinations. They can become anxious, combative, paranoid. And they can also develop decreased attention span, problems with short-term memory, as well as difficulty sleeping. So the question is, what can we do? So similar to dementia, there are many causes for delirium. These usually tend to have an underlying cause, something that it's driving the patient towards delirium. So as doctors, We will perform all the necessary tests and evaluations to determine what's the cause and treat it accordingly. Now, while we work on that, you also play a very important role in helping the patient. This is because you're a person, you're a face that they know, you're a person that the patient trusts. And as such, you can help them by being patient with them, supporting them, reorienting them, reassuring them, and making sure and to help them have a better sleep hygiene. So this is all for this video. If you're interested in learning more about delirium and dementia, I've left a couple of links in the description down below. Also, if you have any questions or comments, please leave them in the comments section down below. If you like this video, please leave a like and subscribe. It means a lot. And I'll see you in the next episode. In the meantime, I wish you a happy and healthy life.